The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
Good morning and welcome to Project Independence and You on 88.1 FM and WCWP.org. This is Community Talk Radio. I'm Rebecca Miller, along with Kristina Liu. We'll both be hosting the show today, and our show is really going to be packed with a lot of information. We have a really wonderful panel from Parker Jewish Institute, and we're really grateful to have everybody here. We've got 3 different programs that we're going to be talking about, so we're just going to go right into it because there's a lot of information. Our guests are Arpan Phillip, who is the medical director over at Parker at Your Door, along with Kathleen Hall, who is the clinical operations manager also at Parker at Your Door. Then we have Dawn Hagen, and Dawn is with us. She is the project director for Willing Hearts, the Helpful Hands program. And then Carmen Quinones is the project director at Hope and Healing. So thank you all for being
Beck,
here.
you got through that. That was quite the lineup there.
In one breath, too. Thanks to yoga, I was able to, get it all out at once. But so we have a lot to get through. Always, looking forward to great information, especially for our North Hempstead senior residents. So let's get right down to it. So we have Dr. Phillip, who is the medical director, and Kathleen Hall, who is the clinical operations director at Parker at Your Door. So I'm just wondering if you can give us a little bit of a background on Parker at Your Door and kind of how it functions, how it started. I'm sure there's an interesting history behind these 3 programs individually, and also, just to kind of get a background on all 3.
Sure. So Parker at Your Door is a physician NP-based home care services program for homebound senior citizens who have chronic medical needs that, who are unable to get out of the home to see their physicians. So we provide those services to their home. We've been in this program for several years, and our numbers, are increasing day by day, our patients. We do cover several areas, including Nassau, Suffolk, Queens, and I believe Brooklyn, and parts, I believe, Westchester as well. I am responsible for the overall medical management of these, patients through our nurse practitioners. So we provide these services which are, desperately needed, and we've been doing it for several years, as I said, and our patients are very thankful and for our services. We take great care to make sure that everything is everything is taken care of. Medications are sent to the pharmacies in a timely manner, and some of our patients are very complex. They require multiple consultations, and we actually discuss their issues with their consultants, be it cardiologists or surgeons or any other subspecialties of medicine. So we, as I said, we're available 24/7. Families can call us anytime, and we do. As I said, we also have nurses, social workers, and care navigators, in addition to the physicians and the nurse practitioners who are involved. I'm the medical director for that, and I'm also the associate medical director for Parker Jewish Institute, which is based in New Hyde Park. We are a long-term care facility as well as a subacute care facility. So we provide post hospitalization services, rehab services for patients that are admitted to our area hospitals, including Northwell, NYU, and several other hospitals, large hospitals. So we have the experience, we have the capabilities, and we're happy to provide these services for patients in the community.
Doctor, how do you get most, I want to say, of your referrals? I mean, you'd mentioned people can just call directly. I mean, Parker at your door. Does it come most, do the clients, maybe their doctors say, hey, Parker at your door is really a great fit? Or where are they hearing about Parker at your door for the most part? And how do they connect? What's the most common way to get in touch with you?
So we have a number of agencies who we work with that we refer back and forth to. A lot of our patients are referred from the transitional care managers, from Parker Jewish Institute. We work closely with Dawn and with Carmen as well. As a matter of fact, yesterday we opened a case where the family had been already involved with Dawn's group, and they were referred to us because the patient was homebound at that time. We do run regular ads, so we do have members of the community that call in from word of mouth. And we have people who just know about the agency because they are visiting somebody at Parker Jewish Institute or have someone in another program. And as I say, we work with a number of other groups. We make referrals to home care groups and physical therapy groups through our lab and with diagnostic testing. So these groups know us. So if they're working with a patient who's seeing a physician and suddenly they have a change in condition and they can no longer get home, we're sort of at the forefront of their minds that, hey, Parker at your door provides a service where they'll come right to you and we can still be involved and that sort of thing. And that provides a level of comfort to the patient as well, knowing that, they already are working with someone who's familiar with us. And we do get a lot of referrals from physicians as well when they realize that their patients are no longer able to get to see them regularly and they don't offer this kind of service, that they'll say maybe you should make a call and see what these services can offer for you.
So if somebody does become a client, do you do regular visits, weekly visits, or it's really as you evaluate them and determine what their needs are? Because you mentioned so many wonderful services, social work and nurse practitioners and doctors, and I'm also curious as to the level of, I'm going to say, what you do there. I mean, are you drawing blood there? Are you doing physical therapy? Like, what are the services that the range of services you can do at the home as well?
So our nurse practitioners visit, they'll open a case, and most patients are seen every 4 to 6 weeks, just for routine follow-up. And as Dr. Phillip was saying, we manage medications, we manage diagnoses from, I'm really fine, I need to take my blood pressure medication, so we're just going in to check. And then more complex diagnoses will sometimes require, additional visits in between, and we can do them. We can do telephone visits, we can do telehealth visits, or have a practitioner go to the home as needed. And we really do have quite a range of patients, to the really, really stable patients who are just getting older and are dealing with, some of the more common issues that we all have as we get older. And then you have more complex cases where there are chronic blood pressure issues in addition to, possible dementia,
heart failure,
right,
and other complex, more difficult issues. So it all depends on the patient's comorbidities. So if a patient is more complex, has more comorbid conditions, we will see them more frequently, because we may have to do more frequent blood work to make sure that their electrolytes or other things that we look for. Monitoring factors are within the normal range to keep an eye on it, because a lot of our patients are on multiple medications, which can have interactions. So it all depends on the patient. We have spectrum of them. We have patients who are more stable to the more complex, sicker patients.
And we have a range of services. We do transitional care visits for our patients, or even for new patients who are coming out of a facility and transferring back into home, transitioning back into a home care setting, not necessarily always sure of what services they need. We have chronic care management, and those are the patients who have some of those issues or multiple issues that Dr. Phillip was just referring to, that really need to have that blood work done more frequently, that need us to either consult with their family or the patient or another physician involved. We're their primary care physician, but there could be cardiologists, neurologists, other, specialties involved that they are seeing outside of our service, and we'll consult with them. And for those chronic care cases specifically, there's a lot of time and effort put into making sure that you don't lose the thread on them and somebody doesn't have something done that they need to get done in a more timely fashion. There's a higher level of care there, a more collaborative effort than, say, your patient, again, who's being seen routinely, for, high blood pressure or, one or two issues. And we do, to your question about lab work, we work with a lab who will go into the home within 24 hours, draw the blood, get us the results. Again, those results come to us within 24 hours. If we run it stat, they come sooner. We can schedule them to do routine. So if a patient's on blood thinners, we can tell them, you need to go every Wednesday, you need to go, twice a week, you need to go once a month, as well as diagnostic testing. If somebody needs an EKG or an X-ray, some ultrasounds, Dopplers, we work with a couple of groups that can get in and do those things all in the home to keep the patient from having to be hospitalized, if at all possible, and treat them collaboratively between the nurse practitioners and Dr. Phillip and any other physicians that are on the case. Just sharing information, sharing their notes, finding out what the other physicians, are doing and what they're working with, and really just making sure that you're staying on top of each case and providing them what they need specifically.
Yes, our goal is the quality of life for the patient. If the patient is, at the end stage of an illness, we want them to have the time that they have to be comfortable. We don't want them ending up in a hospital or an ICU where, all these complex procedures are performed, but it doesn't really improve the outcome. So we would have that palliative care discussion with the family so that the patient's quality of life is respected and comfort measures can be implemented as well.
So we will do referrals for hospice. We have a packet that we leave with the patient when the patient is first brought on to service, for the family and the patient to review. A lot of patients come on and already have a healthcare proxy or a living will, but we leave a more comprehensive packet that does have information about hospice services, about Dawn and Carmen's programs. It has different paperwork from the state, that to indicate if you want long-term care, what the things you want are. And on the next visit, it's discussed. And there are times where someone doesn't need anything at the moment. And then there's a change in their condition, or they start to transition, as Dr. Phillip was saying, some of these patients have been on long-term, and, as they get older, and they develop more chronic conditions, sometimes it is appropriate to then have that conversation about palliative care and hospice care. And the goal really is to keep the patient home if that's their wish, keep them comfortable in their familiar surroundings with their family, and not go through all of that traumatic, transferring in an ambulance and possibly ending up in an ER where your family can't be with you, especially, in the times where we're living. You're dropping somebody off in an ER and you don't know what's happening anymore after that. And so, our goal is to keep that patient home and comfortable if that's their wish, for as long as possible. And that advanced care planning piece is a very big part of that, and reviewing that routinely several times throughout the year. If there's a change in their condition when they're hospitalized and come home, and just making sure all of those pieces come into place. There are things that you don't normally think of, when you're younger or you're well, and there's no reason for you to think, who's going to make a decision if something bad happens to me. But that really is the time to have those conversations. And so we try to get that in right away. And even if you don't want to have the conversation right now, or if it's not appropriate for you right now, you've at least had the opportunity to review the information and to keep that information with you, so that later on, you or a family member might say, oh, I remember, we talked about this 6 months ago when the nurse practitioner was here, and go back and revisit that information, when you're more comfortable, or when there's a change.
Now, is there particular qualifications for this program? Like, how can you fall under this, category of getting the services?
So the patient has to be homebound under the Medicare guidelines, which since COVID are a little bit different. There used to be a more stringent directive about what homebound meant. But now, because there are so many people and because it's an elderly population mostly, and they do already have risk factors, going to a physician's office, even though a lot of the restrictions have been lifted, going to a physician's office where there are already sick people, it's not always ideal. So you do have to be homebound under that regulation. And that really could just mean I can't get out of my home without having to call an ambulance, without having a family member come and pack my walker up or my wheelchair, all of those things that make it difficult to routinely get to a doctor's appointment. And really that impacts your care.
Yes.
If you are not able to get out of your home to get to a doctor.
So patients who have chronic degenerative neurological conditions, paralysis, stroke, severe dementia where they're bedbound, they're on tube feeding. These are the patients that are, have difficulty with ambulating. They need care with everything, ADLs, activities of daily living, toileting. Patients with severe heart failure who get short of breath with minimal exertion. Those are the type of patients who are essentially bedbound and they cannot leave their home. So those would be a few examples.
Yeah, there's a broad range. People hear homebound and they think of a lot of those things. Well, they're bedbound but we have people who aren't necessarily bedbound who, for other reasons, can't make it out of the home. Those more complex cases, of course, those are the cases that people think of right away. Well, my dad's not going to meet it because he gets up and he goes to the chair every day, or he does go out and sit in the garden, but that doesn't mean you can easily pack him up and take him to the doctor if he gets a sore throat.
Right.
And that's something that we provide as well. We're coming to see you every 4 to 6 weeks for most of our patients. But if you call and tell us, we think someone has a UTI, or they've been coughing, or they have a rash, or they fell in the bathroom last night, we can go and see you, either that day or the next day. And again, this is someone who may be able to go to the doctor when you plan for it for 3 weeks, but in that moment they can't. And again, you risk a trip to the emergency room, possible hospital admission. So, these are the patients that we try to help and keep them safe.
And the other issue is a lot of the doctor's offices, they can't accommodate stretchers. So
true. Yeah.
That's another issue. If a patient is bedbound, they cannot go in a wheelchair. They have to be on a stretcher.
Right.
So that's a physical restriction. The office can't accommodate that. But if we can go into their home, that resolves the issue.
Great information. We actually have to take a quick break. We're speaking with Dr. Phillips and Kathleen Hall from the Parker at Your Door program, also Dawn Hagen, Heart's Helpful Hands program, and Carmen Quinones, Hope and Healing. We have to take a quick break and we'll be right back with Project Independence in You.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
And welcome back to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, and along with Kristina Liu, we are the hosting team today. And of course, Kristina is also the radio show producer who pulls these programs together and schedules all these wonderful guests. And today is no different than any other week when we just have wonderful representatives from all different aspects of our North Hempstead community. Today we're talking with Dr. Phillip, who is the medical director over at Parker at Your Door, and also the associate
Yes.
Medical Director for the Parker Jewish Institute. Also, we're speaking with Kathleen Hall, who is the Clinical Operations Manager for Parker at Your Door. And we're going to be speaking very shortly with Dawn Hagen, who is the Project Director for Willing Hearts, Helpful Hands. And then with Carmen Quinones, who is also a Project Director over Parker as the umbrella with Hope and Healing Program. So we're just looking forward to hearing all about these great programs that are at the Parker Jewish Institute. So how are you, Dawn?
I'm doing great. Thank you. Thank you for having us. Great honor.
Well, we're very happy to have you and provide all this information to our listeners, our watchers, everybody who's going to be seeing this maybe down the road too. So can you give us a little bit of a background on Willing Hearts, the Helpful Hands program, how it started? And then we want to hear how you all work together, because Kathleen talked so much about, how you're working, you and also Hope and Healing all connects together with each other.
So Willing Hearts, Helpful Hands program actually was in existence several years ago, almost like 15 years ago, where it started out a very small program where it was a volunteer caregiver program where we worked with volunteers who served as friendly visitors who would go into the homes of frail elderly adults and spend time with the person to just kind of engage them, socialize with them, keep them company, whereby giving their caregivers, their primary caregivers, a little bit of a tiny break to just kind of alleviate some of the stress and burden that comes along with caregiving. Mm-hmm. So back in 2016, Parker Jewish Institute was awarded a grant from the New York State Department of Health called the Alzheimer's Caregiver Support Initiative. And really what we did was we took the original Willing Hearts Helpful Hands program and put it on steroids and created the Alzheimer's Caregiver Support Initiative, working with families in Long Island, both in Nassau and Suffolk counties, to provide caregivers with the supports and resources that they needed so that they could continue to care for their loved one with suffering from Alzheimer's or some other form of dementia. So we launched the program in 2016, and here we are in 2022, and we are actually in our second grant cycle for another 5 years. It's a multi-year grant, and it's a multi-million-dollar grant. So the services we provide an array of services to caregivers. So unlike Parker at Your Door, our patient, if you will, or our client is the caregiver, not necessarily the patient or the person who's suffering from Alzheimer's or dementia. So our focus is really to support the caregivers. And how this initiative really came out was, a lot of families and caregivers were saying, great, it's wonderful that there's all this, research and fundraising and, awareness about Alzheimer's and dementia and to find a cause and a cure, stop it and all that kind of thing. But a lot of the families started saying but while we're in the midst of caring for our person, what is there for us as caregivers? What can we get? What services can we avail ourselves to so that we can continue to care for our loved one? So the programs that we offer are really, like I said, geared toward the caregivers, and we provide an array of services from caregiver consultations with our licensed social workers. We run support groups for families and caregivers. We offer education and training programs on how to take care of a person who's suffering from memory loss and suffering from cognitive changes. How to, what are some of the, how do you manage some of the behaviors or some of the symptoms that, that arises within dementia. We have social enrichment programs like our memory cafes, which those are really great and unique. And it's really an opportunity to bring the family and the person with the dementia together with a group of other folks. And we, usually we go out to a local restaurant, we'll have a light meal, we'll have live music and entertainment. And it's really just an opportunity for families to get together, network with each other, kind of, get to know each other, because many times our families report that they become very socially disconnected from, the community at large because, they're so busy caring for their person that they've had to cut back on their work. They've had to cut back on their social engagements. Friends and other family members are no longer inviting them over for, social entertainment, holidays, and things like that. So it becomes a very small world for many of our caregivers. And they're so, knee deep into the thick of it, with caregiving, that they oftentimes don't have an opportunity to engage in those. So we do our social enrichment programs like our memory cafes. And then we have a very specialized program where we work with the volunteers, again, like originally with the Willing Hearts Helpful Hands program got started. And we work with volunteers. We identify volunteers in the communities where our families live. So we screen them, we train them, and we really try to connect the families with the volunteers within their own communities. And the volunteers will go into the home, spend time with the person who has a dementia, maybe do an activity, watch a ball game, listen to music, go out and sit in the garden, pick flowers, do something, maybe do a craft. And it's really just to give the caregiver a little bit of a break. And it's actually evidence-based that if a caregiver has anywhere from 4 to 6 hours a week of respite, it's not enough. It doesn't necessarily take away the stress and the burden, but it allows them enough time to just recharge their batteries so that they can actually get back into taking care of their person. Just a little time off for the caregiver to recharge. So that's kind of the program in a nutshell. We've been, like I said, we've been doing this since 2016. We hit the ground running. I've been with the project since it got funded, and I'm very passionate about it. We serve over 7,000 families on Long Island.
Wow.
And part of and other areas too.
Excellent.
So, yeah.
Denise, I'm curious too. So, I mean, there's this. We talk a lot about this on our shows and have for years. That caregivers sometimes don't identify themselves as a caregiver. They're just the wife. They're the parent. They're taking care of the person, and kind of it's an awakening, because I remember very early on when we first started with Project Independence, and one of our residents who I was really good friend, friendly terms, and we were talking, and her husband he had some form of dementia, and I remember saying, I said, I'm glad to see that you're out. She was at an event, as the primary caregiver, and she's like, oh, I'm not the caregiver. I'm his wife. I'm like, well, you're taking care of him, right? You're the primary caregiver. So I'm curious as to, your take on that. And also because they're caregivers, are they considered the client? And I'm thinking more in terms of like insurance and payment, or is this program all grant sponsored, all funded by the Department of Health, these grants that you're getting?
So that's a really good question, Rebecca. The Willing Hearts Helpful Hands program, because it is funded by the New York State Department of Health, all of our services are free of charge to our families. And so I use families and caregivers interchangeably, because it's usually the families who are the caregivers. And to your point, you're absolutely right. A lot of times families don't identify themselves as caregivers. They think of caregivers as the paid home health aide or like a paid chaperone kind of thing. And so really that's part of what we do. It's that, we actually run a presentation on caring for the caregiver. Like, what does that look like, as the adult daughter caring for an elderly mom, or a wife caring for her caring for her husband. Or we even actually have a men's group, a men's support group, and it's really husbands caring for their wives. And, some of the things that they're dealing with, and they never even thought that they would have to do some of the things that they have to do to take care of their person. So unlike Parker at Your Door, where, there is a Medicare and Medicaid component of, the health insurance component, our services are free of charge. So we're not so clinically based. We're more, supportive and case management based.
That's great.
I'm sure what would be the best contact number to get in touch with your program?
So to contact Willing Hearts Helpful Hands, you would dial 516-586-1507. That's our main number. And then we also have a website, which is willingheartshelpfulhands.org. And if you wanted to email me, you can find me at whhh@parkerinstitute.org.
Great.
So you asked for a phone number. I gave you 3 different modalities.
If we could also get that same information from Dr. Phillips and Kathleen, the best way to get in touch with Parker at Your Door.
So we have the same kind of contact information. You can reach us at by calling 718-289-2606. We have a website, parkeratyourdoor.org. And you can email us as well at parkeratyourdoor@parkeratyourdoor.com.
Parker Institute.
Parker Institute. Sorry. Thank you, Dawn. at Parker
Finish up,
Institute.
Thank you. So let's now just talk briefly also with Carmen. Carmen, you've been patient. You're just, we went in no particular order. I went in the order of Kristina's list in front of me. So Carmen Quinones is the project director for Hope and Healing. And if you could just give us the same kind of background, who your clients are, how it all started, we'd love to hear about this program as well.
Thank you for having me. Parker at your door, I'm sorry, the Parker Jewish Institute received a grant from the Jewish Federation of North America to start a program to support families who are caregiver families of older adults with dementia and with a history of trauma. What is trauma? Everybody has experienced trauma. We all have experienced trauma in the past year alone, in the past 2 years, right? Every single person has experienced some trauma. And what we want to be able to do is help the caregivers who are especially taking care of somebody who has a Holocaust survivor with dementia. It could be very complicated. I'm sorry. The survivor has a lot of history of confinement and displacement, and being able to provide support to the families as they go through helping the recipient.
Right. Wow. It does sound very complicated, but
Excuse
it's
my
a wonderful program.
So what we do is we provide person-centered care by making sure that the client I'm sorry.
That's okay.
Yeah.
We're
This
just
is my
talking
first time
here.
doing this. I'm sorry.
Yeah, please.
That's okay. It's the program sounds wonderful, and it's so important what you're doing, Carmen, over there, because there's so little understanding for the different levels that caregivers need. Like you're talking about, something I'm even being in the business for so long, I never really thought about, maybe a different technique you need to help a caregiver who's dealing with, someone who's been through, let's talk about trauma,
So
such,
yeah, so it becomes complicated when the client is reliving the past,
right,
and
right.
they're living that past in the present moment, and being able to help the caregiver understand what the person is going through, so that they could then keep their momentum going, bring them back from the past into the present, and help them live a better life. So we're also trying to help the caregivers understand that they also are experiencing a trauma. It could be a secondary trauma, it could be a generational trauma, and helping them to understand and give them wellness, give them different programming so that we could help them live a better life as they go through this journey with their caregiving.
Right. When did this program start up?
In March. It's a brand new program.
Oh, wow.
Right now.
Wow.
So I've been here for a month and a half or so, where I'm just basically going out into the field and just trying to feel out what's the need and where are the clients, what's going on, what they want is basically what I'm really reaching out to, and developing the program has in the need of the client, because this is person-centered care, which means the person has a voice. We try to help them acknowledge that there's a trauma, and sometimes peeling off the layers of the trauma, right? Because it could be many years of trauma that they have gone through. It could be one trauma that happened when they were a child, and now all the traumas that come later on have been packed in there. So peeling off the layers one at a time to try to help the person live a better life and to provide better care.
It's great. It's so wonderful because it's so, years ago, I remember when my grandfather was ill. He was always very healthy, very in great condition. They lived in California, and all of a sudden he recognized that there was something wrong with him physically. And he had gone to the doctor, and 25 years ago, the doctors were more like, listen, you're getting older, you can't bowl forever. and don't worry about it. And he was saying, it's more than that, and he tried to explain, but it was, and so he kind of thought that's what was going on,
Okay.
and then of course it turned out, unfortunately, to be the demise, and he had colon cancer, and it was really traumatic. And my brother and I were just like, why didn't they just like listen to him? I mean, if I went to the doctor with these symptoms, it would be like, oh, okay, go here. But it's a different world now. So I think to myself, my God, if my grandfather, if these types of services, and they're so progressive, but really should have been around forever,
Right.
I mean, our senior population is, I mean, you guys all know the stats. We've got, 10,000 people a day turning 65, the whole baby boomers, people are living a lot longer. I mean, when we were kids, it was so rare to hear someone was in their 90s. It was so, oh, wow, your grandparents are in their 90s. Now we have, people winning like senior awards who are 103. It's a very, and then we've got all these people 65. So that's the real, we talk about this all the time. The real silver tsunami is so many people hitting 65 and so many people living a lot longer. And, in your, Carmen, talking about people that are, still around from the Holocaust. So it's wonderful that you are providing these services. I mean, I'm floored, what all of you all are doing. And of course, now we have to take a break. I'm not going to mention all of your names again. I think you guys are, we're going to come back and I'll introduce you when we return. So you're listening to Project Independence and You here on Community Talk Radio, 88.1 FM, WCWP.org, and we'll be right back.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
Welcome back to Project Independence and You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, along with Kristina Liu, who is the radio show producer, and we are your hosting team today. Quite a show today. Our wonderful guest, Dr. Arpan Phillip, who is the medical director associate medical director over at Parker Jewish Institute, and also the medical director for Parker at Your Door. We're grateful for you to be here. And also to Kathleen Hall, who is the clinical operations manager at Parker at Your Door. Also, Dawn Hagen, thank you so much for being here. And you're the project director for Willing Hearts Helpful Hands program. And of course, Carmen Quinones, who is the project director at the very new program, which is just a wonderful program, Hope and Healing. And I really hope you get the word out. I'm sure Kristina will be in touch with you. Maybe we can get you to talk to some of our seniors. One of the things I did want to talk about with all three of you is, we talked a little bit about it at break, is the virtual component, and I'm sure that we all had to kind of adjust to it a lot during the pandemic. Home visits became, I'm sure, quite tricky. For a lot of different reasons, and but staying connected and with the seniors, and what we learned too at Project Independence is because we have an expansive transportation program, which is a whole nother story how we kept that going. But all of our supportive services, we have community, we have nursing and social work, and we just went right to Zoom. I mean, it was like, all of a sudden you kind of heard Zoom, what it was. And then, by the time we all had to work from home, Zoom was it, this kind of level of communication. There are others too, of course, Google and Microsoft, all of them. But so I'm so curious how Parker at Your Door, especially, this home care program, functioned during the pandemic, and how you were able to if you were even able to go into the home, and also how you benefited at the time from becoming virtual, and if you're still using those same, if you're still Zooming or using your virtual programs.
So we are, and yes, obviously during the pandemic, it was a lot more out of necessity. A lot of the visits prior to COVID, almost all of them were face-to-face visits in the patient's home. There are times where you have something urgent or even not so urgent that a nurse practitioner is not close by or can't get there right away. And so it's a good tool in those situations, but it's not always ideal. And with COVID, it became, even for just a routine visit, something that we really had to figure out how to do. And so a lot of those visits became televisits where you're using, we go through our EMR, through our medical record, and we can schedule that test, and we give the patients or the patient's family instructions on how to log in with us. And the nurse practitioner can do her visit right through that system and be documenting while she's having that conversation, exactly what's going on. We've more recently put together a packet of tools for telehealth visits where the patients will have more at their disposal to really get the most benefit out of that visit. So, it won't just necessarily be guessing certain things. They'll have a little kit that has a blood pressure machine in it that has different tools in it that can help them give the nurse practitioner even better information than just sitting here like we are having conversation and saying, oh, look at my rash, or this is what's going on with my throat. That there'll really be some good diagnostic tools being used in those visits, that the nurse practitioner is getting a much better picture other than just this picture. And so we do use that tool when it's necessary right now. And most people prefer to have those home visits if they can do them. We still have a few people who prefer to do those televisits. And most of the televisits, the true televisits, are done, in this sort of, face-to-face kind of way. But we do use telephone visits, as well, sometimes just to get a feel for what's going on. Because it might be something simple that a nurse practitioner who just saw you a week ago, can pull up her notes and say, oh, we did discuss this. Let's do this now, and I'll get some blood work done, and I'll be there, in 3 days when we get the results back. So there are several different, ways to go about doing those telehealth visits, and they're really, really an important component to really rounding out the care.
Yeah. And I remember in the early part of 2020 and mid 2020, I did several televisits because, this was a new virus. People were afraid for other, people from the community. The families were afraid for their loved ones. They didn't want other people coming into their homes. And this was the lifeline for them, doing these visits, because, I could see the patient, the caregiver could hold the phone, or, in a certain way where they wanted me to focus. And then I did several of them from home, because we ourselves here at the Institute were rotating. Several physicians, one physician would be working from home for a week. The other one would be in-house, because we didn't want, everyone to get infected at the same time. And then that would be a problem. So we were doing our own thing. And I did several of these visits, and it was very helpful for the families.
Yeah. Thank you. So, Dawn, how about your program? How did you kind of utilize, the virtual highway, and then kind of, are you still using it today?
So yeah, that's a really good point. And we once the pandemic hit and the world shut down, unfortunately, all of our in-person programs had to shut down as well. So we canceled all of our support groups, our in-person support groups, canceled all of our joint opportunities. The volunteers had to stop going in and visiting in person. And within a matter of days, we were able to, convert everything onto a virtual platform, whether it was through a webinar or through Zoom and that kind of thing. And then we started offering like live music programs, each day, twice a day. We started offering exercise and yoga programs online for our families. The social workers were making, wellness calls just to check in to see how are you doing, through our, with our clientele, through our database, we would call, our social workers were calling routinely, checking in. We did a lot of virtual home visits, in the sense we would set them up with, either FaceTime or through Zoom or something like that. We were still able to stay connected and stay in contact with our families. Our volunteers, actually, they would go and do drive-bys or drop off food to their families. They would, would do, again, FaceTime and, Zoom visits, do telephone reassurance with, with many of their families that they were connected to. So we never stopped. And actually what had turned out, now we're getting back into the world. We're starting up our support groups again, starting our live memory cafes in person, going to the local restaurants. And then we're still continuing our daily programs each day, whether it's a live music performance or a brain activity or like a yoga or exercise or Zumba class, online. Actually, I'm getting a notification now. The Zoom with Sari is starting at 11 o'clock.
Oh, nice. You'll be able to make it.
The one downfall that, we really had, and this was a challenge, is that many folks who don't have a device or internet or a computer or are not, computer savvy or not, don't know how to work the internet. Unfortunately, we weren't able to really connect with those folks other than through the telephone. So we, folks who didn't have an email address or didn't have a, device that they could watch or view any of our programs on, like I said, our social workers and our staff were calling them to check in and say, how are you doing? What do you need? And try to connect them with local services or local resources in their communities. We worked with a home care agency that, even though they were still, if the families needed home care, they were sending in home health aides. But they also started a Meals on Wheels program. Like they would deliver meals, to the families. There was a slight fee involved, but like they got that started right out of the pandemic, and so that was really a great benefit and a great service for our families.
Just so you know, Project Independence in You on the government channel, if they have Verizon or cable on regular television, they can watch a host of senior kind of focused programming from exercise and other programs. We run fitness on the North Hempstead television 3 times a day, Tai Chi, yoga, and general fitness classes. We offer how to do it on the chair, making sure the chair is very safe. And what we found over the pandemic was that we got calls to our 311 call center. People who've never even exercised before started watching the show, and you're never too old. Like really, you could sit in a chair and do whatever you feel you can do. And again, we got calls from call takers. That while they're home and over the pandemic. So we also have a lot of seniors that are not ready, or they may never be ready to use technology, so they call into Zoom programs that we have too, because there's always a call number. But just so you all know too, you can advise them to watch, and we'll be happy to send you the schedule of the programs that we have, because if they're in the town of North Hempstead, and I think you really can get the shows outside of North Hempstead.
They can, because I've heard people have watched, because our radio show, this show will be on North Hempstead TV. People might be watching this on North Hempstead TV. It's very meta at the moment. But, in Glen Cove, I know it was reaching some people. And
West Islip. From there. Yeah.
So you never know. You could just pop up. But I think, what all of your programs, just sitting here, I mean, if you could only see the papers all in front of me, because I want to get all this information to our staff as well. It's just, you could tell that each of you are passionate about your individual program that you're working with. And I think it just shows, especially during the time of the pandemic with all this uncertainty and just coming together and thinking outside of the box, and still getting those services to people, just really show the success of everything that you guys are doing. So I just had to say, I certainly have so much amazing information. Rebecca and I always say every show, we're in the business, but I learn something new, every show. And I can't wait to get this information out to our staff, to our seniors, because I think it's just so important to know that, when you're dealing with these horrible situations, there are support services, available out there.
We hear a lot, because we do a lot of programming for seniors in the town of North Hempstead. And, we've been doing it for over 15 years, and there's people that come in, we think, oh, everybody knows about Project Independence. You can call 311. We have brochures everywhere. And yet there are still people that said, why don't you advertise? Why don't you do these things? So we are doing it. It's just, I don't know. I don't know if it was Kathleen or Dawn who mentioned, kind of advertising or not, or, how you get the word out, and you guys have, of course you're with Parker. So, a lot of the doctors, I'm sure, on staff are, you have to also educate them about this kind of availability. But, it's like, I just want everyone to know about everything that you're doing, and it's just, when people are surprised, well, we're going to tell them now for sure. And I know that our community nurse and social workers that work for Project Independence, we subcontract them through EAC and also Northwell. They do refer to your programs.
Yes. Yeah.
I know that they're fully aware of the services. Carmen, I mean, this is such a new program and a new option. I don't know really if they're aware of it, but we're certainly going to let them know. Do you do anything? Have you structured in any kind of virtual component with your program?
Not yet. What I'm doing, we have a cafe coming up, a memory cafe coming up on Tuesday. Is our first one. We have full enrollment, 12 families, so 24 participants will be showing up for that. 4 or 5 of them have applied for the program, and so they're slowly trickling in. They're all curious to know what this program is about, because they feel that some of them feel like they don't have trauma because it's everyday trauma, right?
Right.
And so being able to just help them and empower them, and give them a voice, hear their story, let them know non-judgmental that we're here for them, that Parker is here for them, that somebody from Parker will be there for them through this whole journey. I think that's where we're aiming for. We're going to do virtual wellness programs. They're going to be in person and available virtually so that people can see. Our goal also is to, once we're at the cafe, is also to, show it virtually on Facebook or something like that so that people see other socializations and stuff, and maybe encourage people to come out and not be afraid.
Carmen, I don't know if we got your best contact information. Did we get, what's the best?
No, we didn't. But
Right. So it's, the phone number is 516-586-1509. And the best email to reach is hope@parkerinstitute.org.
And your, also Dawn and Carmen, are your programs kind of like Parker at Your Door, available to anyone as far reaching as Queens and Suffolk and Nassau?
Yes. Well, we do Long Island. I do Long Island.
Long Island,
all of
okay.
Long Island.
Right. So Parker, when we got the grant from the New York State Department of Health, we were funded. Actually, Parker was one of 10 organizations throughout the New York State region. So Parker got funded to serve, families on Long Island, both Nassau and Suffolk counties. But, Queens also is like, it kind of borders. So, depending on, it's on a case by case basis. But there's like, if it's in Queens or Brooklyn or anything like that, there are New York City based organizations that receive similar funding to like what Parker received. So in that case, we would, we wouldn't turn the caregiver away or turn the families away, but we would connect them to those local services in the New York City area.
Mm-hmm.
Okay.
Our primary region is Nassau and Suffolk County.
Right. Okay. One thing I wanted to ask, Parker at Your Door, I don't think we touched on it too, but because you are providing services, you didn't mention anything about being grant funded. So I assume that people are able to utilize their Medicare, their insurance, whatever.
Yep, we're insurance based, so that goes through their insurance. We're not a grant program.
Okay. So, I mean, it's wonderful. So people at home can utilize their healthcare insurance, probably take mostly everything, I'm going to assume, or are you mostly Medicare?
We do a lot of Medicare, but we work with many other, and we continue to enroll in insurances as they, become more prevalent. But we do take most insurances, and we will speak to patients before enrolling them. We'll do their eligibility. And if it's not someone who we've worked with before, or that we know, we don't have an agreement with, we will call and work with that insurance company
Okay.
to see if there's a way that we can, take them on and have a one-time agreement or a special agreement that we can work out a rate and the patient still can receive the services that they're asking for.
It's wonderful. So, I mean, there you have it. You've got, your can accept insurance, and the other two programs are funded through grants. What from the health department, and I'm sorry, Carmen, your grants, are they also through the Department of Health?
Jewish Federation.
Jewish Federation.
North America.
Right. Well, we are at the end of the program. Next program is Talk of the Town, and we'll have Taranza Murray, who is the director and a deputy commissioner over at Parks. But I want to thank you all for joining us and taking a full hour of your day. You guys are so busy, and we're really most grateful to you, Dr. Phillips, Kathleen Hall, Dawn Hagen, and Carmen Quinones, for all this fantastic work that you do. And, continue doing it. And we look forward to working with you in the future and definitely helping to get the word out. You're listening to Project Independence and You, a Community Talk Radio.